The pharmacology of the autonomic nervous system involves understanding how various drugs interact with the nervous system to produce physiological effects. The ANS is divided into the sympathetic and parasympathetic nervous systems, each controlling different aspects of involuntary bodily functions such as heart rate, digestion, and respiratory rate. Sympathetic nervous system primary neurotransmitters norepinephrine and epinephrine. Receptors adrenergic receptors. One receptor is located in blood vessels, causing vasoconstriction. Two receptors found in the CNS and presynaptic nerve terminals, inhibiting neurotransmitter release. One receptor is predominantly in the heart, increasing heart rate and contractility. Two receptors found in smooth muscles of the lungs, causing bronchodilation, and in the blood vessels, causing vasodilation. Drugs affecting the SNS agonist epinephrine activates and receptors used in anaphylaxis, cardiac arrest. Albuterol 2 agonist, used in asthma for bronchodilation. Phenylephrine 1 agonist, used as a decongestant. Antagonist propranolol non-selective blocker, used in hypertension, anxiety. Prazosin 1 blocker, used in hypertension, BPH. Parasympathetic nervous system primary neurotransmitter acetylcholine. Receptors cholinergic receptors. M1, M3, M5 receptors usually excitatory. M2, M4 receptors usually inhibitory, particularly M2, which decreases heart rate. Nicotinic receptors found in neuromuscular junctions and autonomic ganglia. Drugs affecting the PNS agonist bethane muscarinic agonist, used to treat urinary retention. Pilocarpine muscarinic agonist, used in glaucoma to reduce intraocular pressure. Antagonist atropine muscarinic antagonist, used to increase heart rate in bradycardia, reduce secretions during surgery. Ipratropium muscarinic antagonist, used in COPD to cause bronchodilation. Summary drugs affecting the ANS either mimic or inhibit the actions of the sympathetic and parasympathetic systems. Understanding the receptor types and the physiological effects of their activation or blockade is crucial in applying these drugs clinically. Its primary neurotransmitters are norepinephrine and epinephrine. Adrenergic receptors and examples: 1 receptors location blood vessels, iris, urinary sphincter. Action vasoconstriction, pupil dilation, contraction of urinary sphincter. Example: phenylephrine mechanism 1 agonist. Clinical use: used as a nasal decongestant and for pupil dilation during eye exams. 2 receptors location presynaptic nerve terminals, CNS. Action inhibition of norepinephrine release. Example: clonidine mechanism 2 agonist. Clinical use: used to treat hypertension by reducing sympathetic outflow. Action increases heart rate, increases contractility, stimulates renin release. Example: dobutamine mechanism 1 agonist. Clinical use: used in acute heart failure to increase cardiac output. Example: albuterol mechanism 2 agonist. Clinical use: used in asthma and COPD for bronchodilation. Adrenergic antagonist propranolol mechanism non-selective blocker. Clinical use: used to treat hypertension, angina, anxiety, and prevent migraines. Clinical use: used to treat hypertension and benign prostatic hyperplasia by relaxing smooth muscles in blood vessels and the prostate. Parasympathetic nervous system. The parasympathetic nervous system is responsible for the rest and digest activities. Its primary neurotransmitter is acetylcholine. Cholinergic receptors and examples: muscarinic receptors. M1 receptor increases gastric acid secretion. M2 receptor decreases heart rate. M3 receptor increases glandular secretions, smooth muscle contraction. Example 1 Bethane mechanism muscarinic agonist. Clinical use used to treat urinary retention by stimulating bladder contraction. Example 2 pilocarpine mechanism muscarinic agonist. Clinical use used to treat glaucoma by increasing the outflow of aqueous humor, reducing intraocular pressure. Cholinergic antagonist atropine mechanism muscarinic antagonist. Clinical use used to treat bradycardia as an antidote for organophosphate poisoning. Ipratropium mechanism muscarinic antagonist. Clinical use used in COPD and asthma to cause bronchodilation. Summary of clinical applications: epinephrine is used in emergencies like anaphylaxis. Propranolol manages chronic conditions like hypertension and anxiety. Atropine is used in emergency settings to increase heart rate. Bethane is used to manage urinary retention. This pharmacology forms the basis for treating various cardiovascular, respiratory, and gastrointestinal conditions by modulating the autonomic nervous system.